Hi, I'm Dr. Erin Ducat, a chiropractic physician here in Illinois and the secretary of the Illinois Chiropractic Society Board of Directors. I have stayed open here during the COVID pandemic, and I just wanted to go over some of the protocols I've been using here in my treatment room to hopefully help all of you kind of streamline your process. So bear with me as this is a low-tech video production. First thing that I've done to improve the sanitation here in my office is I'm working out of one room and one room only. I figure that allows me to just really control that environment and keep it spick and span. The more simple I can make this process, the more efficient and the better quality assurance that I have. In my room here, this would normally be where my chair was for people to sit when they come in. It's now gone. It's really difficult to clean fabric, so the chair is gone. I just explained to patients why it's gone. Not a single person has complained. Also, coats, purses, things, they are all going right here. Again, this coat hook, super easy for me to clean. I can wipe down the door in between each patient, so I'm assured that even if someone has to hang something up, that they can hang up their clothes in a very clean environment, and I can clean up after them in case there's any germs that have come in. You know, like maybe they went to the grocery store before they came here for their acute care. That way I can clean that down. Something else that I am doing is I'm having people hang up their coats, hang up their purse, things like that. Oh, one more spot. Here is a nice little shelf, this little spot. Again, I can easily clean off. That's like the cell phone, wallet, keys drop-off spot. Like a lot of people don't carry a purse right now. Men generally don't carry a purse. Put your cell phone, put your keys, put everything right there. Drop it off, go wash your hands, and then come back. Don't touch your cell phone until after we're done with your visit. So that way I can keep everything super clean. And I can wipe off these surfaces with my antiviral sanitation equipment and wipes after each and every patient. Some other things too, the table, here's my face paper. You notice I've got it like this. When I'm seeing patients, I would glove up, and then with that clean glove, I just push the paper down like that, and then I warn the patient, hey, the paper's not under the spindle like it normally would be, so that way they don't inhale the paper. Sometimes it could be a little difficult to breathe because they've got a mask on too, and they've got that paper in their face, but that's been working pretty well. Now, I have a pretty standard chiropractic table, as you can see. Some important things to make sure that you clean, like down in here. So if you're doing adjusting your drops and you have to use your hands to clean it or to adjust them, make sure you're cleaning this, make sure you're cleaning your drop lever. I have to control my flexion distraction here. I also have a flexion distraction handle. I'm making sure all those things are getting wiped down after every patient that I use those for. I mean, not every patient needs flexion distraction, but if I'm using flexion distraction, I'm wiping that handle down. Another important spot is down here at the headpiece. You know, I've got a control here. I've got these controls here where I adjust my headpiece. And obviously I still have to adjust my headpiece. So I'm making sure I'm wiping down those surfaces after every time I use them. Now I do have one chair still in my treatment room, and that's the quintessential doctor stool. Get that into the view. Okay, so if I have to use the doctor stool, I'm making sure that I'm wiping it down, and as I move it around the room, you know, I'm trying to use my foot to do that. I've become very adept at using my foot to do things like moving my stool, closing my door in my treatment room, things like that. The less surfaces I can touch with my hands, the better. Now, I've got a couple of patients that are single moms, and they have no child care right now. And if they're in pain and they need care, that child is coming in with them. So I've only had the situation with one kid coming in with their single parent, and I actually give them my doctor stool because I don't have another chair in here. I don't want that child sitting on the ground. They get to sit on my doctor stool. It's a big privilege for them because I usually never let kids sit in my doctor stool, but that way I can wipe down that stool entirely after they leave and make sure it's clean. If I had more than one kid here, to be honest, probably what I would do is put pull this mat down, put it on the floor. That's their special spot. I can sanitize that mat afterwards with Lysol. It's all good. I just don't want kids on my floor, putting their hands on the floor. I don't want them catching anything down there, and I also don't want them leaving germs on a surface that I can't clean. Other little things. So been checking the temps, screening temps on every patient. So I've got a nice little work surface here where I've got my thermometer, I've got my alcohol, easy access. That way I'm not touching or fumbling through things to get stuff. Up here, I've kind of got my couple of dedicated pens that I can use that I've been sanitizing. And then also my reflex hammer, I can sanitize that. I have been kind of only checking blood pressures if I really, really have to. If it's a high-risk patient, there's something like they come in with horrible migraines or something like that, I'm taking their blood pressure. Otherwise, I'm omitting that from my exam process just because it's super hard to clean my blood pressure cuff. So it's kind of like need to know basis. It's need to check basis. We're only checking blood pressures if we absolutely have to. Over here, I have my hand sanitizer. This is what I normally have in my treatment room. Normally, I'd be using this between every patient instead of gloving up. But now, in addition to that, I am gloving up on every patient. You can see I'm almost out of gloves in this box for this week. Normally, I would glove up only if I'm doing an internal pelvic exam because I do practice pelvic floor therapy, or if I'm doing like a TMJ, internal manipulation or something else like that. So I only had like 250 pairs of gloves on hand, and I anticipated that lasting me the whole year. I put in an additional order because now gloving up on every patient, I am flying through that supply much, much faster than I would initially anticipate. But having them right here makes it really easy to make sure that I change between every patient. Never ever wash your gloves, don't reuse your gloves. Make sure you're changing after each patient. So kind of my flow is after the patient, of course, puts everything over here, they hang up their personal belongings, they're washing their hands, I'm asking my screening questions, I'm screening their temperature. I'm doing that all in one fell swoop. As I'm going to go to take their temperature, I put on that fresh pair of gloves. Those gloves follow that patient. So I'm going to wear those gloves throughout their patient care and anything that I'm doing with that patient. Then when I'm done with that patient encounter, I actually walk them up to the front. A lot of times I'll open up that front door for them so that way they don't even touch that door going out. And as I walk up front, I make sure that I have a sanitation wipe. These sanitation wipes are rated to kill everything. They're the ones that I would use normally to clean my table and clean my office even before this pandemic, and they're even rated to kill HIV. So I'm assured that they're killing corona too. So I wipe down that front door, and then I wipe down the sink, and then I come back in here into the room. I wipe down the table thoroughly, as we already discussed, wipe down all those surfaces that the patients could have touched. If I'm doing rehab, I'm wiping down the mat, I'm wiping down any exercise equipment, any weights that I might use, kettlebells, bands. I'm really trying to stay away from bands as much as possible because they are the hardest to clean. After I do that whole wipe down and everything is clean, then those gloves come off along with the wiping equipment, whether I'm using the wipe or I am also using concentrated industrial strength Lysol as well to clean some of the exercise equipment and things like that, just because it's easier. All that gets taken off together and then put into the trash, okay? Next patient comes in, new pair of gloves, all surfaces are clean, I'm ready to rock and roll. I know this video is getting a little long, but just a couple more things I've kind of learned here in the last month. Also, be really careful if you're on EHR like I am. So here's my computer screen. That's a touch screen, that's a touch keyboard. It's okay to be charting as you're working with that patient, but if I've touched the patient and then I want to go touch my computer, I'm actually using the hand sanitizer first, or using some type of a cleaning solvent, because what I don't want to do is have myself touch the patient and then touch my computer, and now my computer's contaminated, and then I go to touch my next patient, and then I touch the computer, and then go back to a patient. You now can see how that now has become a source of contamination. So at least using the hand sanitizer between the patient contact and the computer is creating one level of protection, and then I am going through with that sanitation wipe many times during the day, hitting my computer, hitting my phone, any of those other accessory surfaces that might be a problem. There's also been guidance to either wear a gown or spray yourself down with Lysol or alcohol in between each patient. I chose the alcohol approach because I don't have access to gowns and I'm allergic to Lysol. So I have a spray bottle that is mixed up 70% isopropyl. I literally will spray down my front. A lot of times I like doing that when I'm wrapping up with the patient encounter so the patient sees it. And a lot of times patients, because that's something newer I've implemented in my office, they come in and they're like, what is that smell? And then I explain to them, hey, this is something extra I'm doing to help protect you. I'm spraying down my front of my scrubs wherever I might make contact with you as a patient, and then also using it on my arms to make sure, in addition to my hands, everything is sanitary in between each patient. And they've been really appreciative and understanding of why my office reeks of alcohol. And I always emphasize it's not the drinkable kind. We don't do that until after shift. Just good old isopropyl alcohol. Okay, so that was like a ton of information. I know I was talking to Mark and some of the other people on the board. I'm like, okay, I want to do this really quick video, just talking about some of the precautions that I've made for making sure that everything is sanitary and clean here in my treatment room. And this is now a 12-minute video. But do try to check the ICS COVID page frequently. I know there's a ton of links, a ton of information, but that's because they're trying to get us the best information out there, and information keeps changing. It's really frustrating. It's just a situation that's going on right now. So make sure you check that page for updates. Also check for different videos, emails coming from the ICS. Feel free to reach out to me or any of the other board members. We're more than happy to help. This is just a very stressful situation because everything is different. Nothing is like what we would normally do in our chiropractic offices. So, you know, that just creates anxiety, it creates stress. But we're here to help. We're in this together. And hopefully this video has been helpful for you and gives you some ideas on things you can do to mitigate any possible transmission of COVID-19 in your office.